Also from the same report, health leaders say a new safety net is in the works to help at-risk teenagers who are battling depression and suicide, apart from the Accident and Emergency Department. Mental Health Commission Chairman Dr. Marc Lockhart says there's no place for kids in trouble to go. Nearly 250 high schoolers have admitted they've attempted suicide. Dr. Lockhart says that figure must change.
What we're going to be doing is forming a hub or a location here within the hospital that will address issues, urgent psychiatric issues for young people.
Joining us now to discuss the most recent student drug report is Lizzette Yearwood, who's a board member of the Alex Panton Foundation. Thank you so much, Ms. Lizzette, for being here tonight. Now, why do you feel that it's so important that the Alex Panton Foundation was formed, and why are you all speaking out about this now?
The Alex Panton Foundation, Kafara, was formed in order to improve the mental health of children and young adults in the Cayman Islands through advocacy, education, and support. And we feel that, you know, it is really important to be able to do various strategies in order to mitigate the stigma that comes with mental health, because oftentimes those individuals who may be seeking services are intimidated because of the stigma.
Definitely. Now, this latest report that came out with the 250 students, you know, possibly thinking about committing suicide, I mean, what is your interpretation of those numbers?
Okay, well, first of all, the Alex Panton Foundation recognizes that the problem is really very complex, and we have a number of strategies that we're going to engage in order to approach this. There's a multi-pronged approach that we're taking, and we want to be able to help those that are currently suffering, and that's through improving the access, because as Dr. Marc Lockhart said, you know, the emergency room isn't somewhere that's really conducive to children and young adults access care. So the Emergency Mental Health Hub is something that we want to partner with the HSA and the Ministry of Health on in order to improve access for our young adults and children.
Definitely. And why did you personally become involved in this foundation to be a board member, to speak out on issues like this?
You know, my involvement started because, you know, my daughter was a very close friend of Alex Panton, who actually succumbed to the effects of anxiety and depression. And that's really the area that is focused on for the foundation. And you know, there are a number of entities and non-profit organizations that are already working to engage the young adults and children in order to mitigate the issues that are causing anxiety and depression. However, but I think what we can do is really harness, you know, all of these entities in order to create more synergy, because through the synergies we actually accomplish a lot more. So we're engaging with non-profit organizations to strengthen our resources, such as the National Drug Council, the YMCA, the Mental Health Commission, the Ministry of Community Affairs, the HSA, and the Loud Silent Voices. And we've done a number of things for the main strategies. You heard about the research, because when the foundation was formed, we really had no idea of the concrete numbers that were
exactly
out there.
What you're working with, you know, what type of figures.
So the National Drug Council were great in that regard, and we are also looking at doing more community outreach workshops. The workshops that we did in collaboration with the Ministry of Community Affairs last year was really based on the data that we got, and we talked about suicide and suicide ideations. And this year, the topics are going to be bullying and mental health, as well as young men at risk. And again, that's in partnership with the Ministry of Community Affairs, because we want to really focus on some of these issues that are actual risk factors for those children that later on develop mental health problems. And again, those workshops are completely guided by the data. And the first one is actually starting on March 20th, and that's going to be happening at the Mary Miller Hall in Red Bay at 6:30 for those that may want to mark their calendars. We're also looking at community outreach through various support groups, and we're partnering with the Loud Silent Voices as well as the Bethesda Counseling Center to offer those support groups. So one of the support groups is actually for the peers who are suffering with anxiety and depression, but also those carers, because parents and teachers and other youth workers need help in order to be able to work with these kids.
Now, Ms. Lizzette, you did mention that there were some risk factors to look for. What are those type of factors that, like, some parents should look out for? Like, what should they be looking out for?
Well, those were two that we already talked about. Those that have suicide ideations. And the workshop went through all of those things to look out for, because even something as simple as cutting Many of the parents didn't realize that that was a risk factor when they came to the workshop and they realized, oh, you know, I saw my youth, my child doing that. How do I get help? What kind of help do I need to get? And then we can actually guide them in the direction of the resources.
Definitely. Now, we've run out of time, but is there anything else you'd like to get out there to our audience tonight?
I just want to make sure that everybody understands that this is an issue that we are working with all of the other agencies in order to try to provide the necessary resources to help the young adults and children suffering from anxiety and depression. We want to thank all of our sponsors and all of the NPOs that are working with us in that regard.
And thank you for your time tonight.
Thank you.